The prostate is a small organ that often goes unnoticed, yet it plays an important role in a man's body. Located just below the bladder and wrapped around the upper part of the urethra, it quietly supports both reproduction and urination. For some men, it remains a silent companion throughout life. For others, it becomes a source of discomfort as they grow older. Is it a blessing or a burden? In this film, we take a clear look at the prostate, explain what it is, what it does, and why it matters so much for male health. The prostate is a gland located deep inside the male body. It sits just below the bladder and surrounds the upper part of the urethra. Although small in size, it performs essential tasks. It produces a significant portion of the seminal fluid, helping to protect and transport sperm. At the same time, its position around the urethra means it influences the flow of urine. Any change in its size or structure can therefore have noticeable effects. It is a small organ with a large impact, quietly doing its work in the background as long as everything remains in balance. The prostate performs several tasks that are essential for the male body. Its most important role is the production of a special fluid that forms a major part of the semen. This fluid protects the sperm, keeps them mobile, and enables them to travel through the female body. At the same time, the prostate influences urination because it surrounds the upper part of the urethra like a ring. Any change in its size or structure can therefore affect the flow of urine. In this way, the prostate connects two areas that seem unrelated at first glance: reproduction and everyday comfort. It works quietly in the background, yet its functions are vital. As men grow older, the prostate begins to change. This development is not a sign of illness but a natural process that occurs in almost every man. The gland reacts to shifts in hormone levels that take place over the years. Some hormones decrease, others become more dominant, and this gradual shift causes the prostate to enlarge. For a long time, these changes go unnoticed, but eventually they can affect the flow of urine because the prostate surrounds the urethra like a ring. Many men find this phase bothersome, and some experience it as a real burden. Yet the enlargement itself is simply a normal part of aging and one of the most common changes in the male body. Many men hesitate before seeing a doctor about prostate issues. But there are clear signs that make a medical checkup advisable. If urination becomes increasingly difficult, the urine stream weakens, or you need to get up several times at night, these changes should not be ignored. A feeling of incomplete bladder emptying or pain in the pelvic area can also be warning signs. These symptoms do not automatically indicate a serious condition, but they should be evaluated. A doctor can determine whether the cause is a benign enlargement or whether further tests are needed. Acting early provides clarity and prevents symptoms from affecting daily life more than necessary. A prostate examination is simpler than many men expect. It usually begins with a conversation in which the doctor asks about symptoms, changes in urination, and family risk factors. This is followed by a physical examination that allows the doctor to assess the prostate from the outside and inside. A blood test may also be performed to measure the PSA level, which can indicate whether further evaluation is needed. In some cases, an ultrasound is used to examine the size and structure of the prostate more precisely. These procedures are brief, minimally uncomfortable, and provide essential information about prostate health. When detected early, many issues can be treated effectively. Treatment for prostate problems always depends on the underlying cause and the severity of the symptoms. For benign enlargement, medication is often sufficient to improve urine flow or slow the growth of the prostate. If symptoms become more pronounced, minimally invasive procedures can be used to gently remove or reduce excess tissue. In more advanced cases, surgery may be necessary, typically performed with modern and precise techniques. For prostate inflammation, antibiotics and anti-inflammatory medication are the primary options. Each treatment is tailored to the individual to relieve symptoms and prevent complications. The earlier the condition is addressed, the better the outcomes tend to be. However, we must not forget prostate cancer, as it is an important part of this topic. Prostate cancer develops when cells in the prostate begin to grow uncontrollably. It is one of the most common cancers in men, yet it often progresses slowly and without noticeable symptoms. This makes regular screening especially important. When detected early, treatment options are highly effective, ranging from surgery and radiation to modern targeted therapies. In later stages, the cancer may spread to nearby tissue or other organs. Still, medical advances in recent years have significantly improved outcomes. The key is to recognize changes early and take them seriously. Looking back at everything we have covered, it becomes clear how important the prostate is for a man's overall health. We explored how it works, what kinds of symptoms can appear, and which examinations help detect changes early. We discussed benign enlargement, inflammation, and the different treatment options available. And we also acknowledged prostate cancer, common, but highly treatable when diagnosed in time. In the end, one message stands out: paying attention to your body, using regular check UPS, and taking changes seriously offers the best chance to stay healthy for many years. The prostate may be a small organ, but it deserves significant attention. This brings us to the end of this chapter. If you found this information helpful, consider subscribing to the channel to support our upcoming health videos. New topics are added every week, explained clearly and without unnecessary details. Thank you for watching, and most importantly, stay healthy.